Ezekiel lost his mother recently to liver cancer. Months before her death, her symptoms were wrongly diagnosed and treated for peptic ulcer. Incidentally, Ezekiel is a medical doctor, but the ethics of the profession do not allow him to treat his loved ones.
When she took ill, and she kept visiting the hospital, the doctors told her she has dyspepsia. Dyspepsia is more like a clinical condition for peptic ulcer disease. And I said, the simple common sense tells me any such ulcer that does not resolve within 6 months is no longer ulcer. Can we look into any other thing in addition to this? But because I was constrained, I was not the one managing my mother here, it became so difficult.
It was when he sought a second opinion that series of medical examinations revealed that his mother had cancer, but at that time it was already too late.
We have so many things in practice too. Someone who is not medically inclined, who doesn't know the pathology of problems, just wrote and I said my mother had hepatomegaly. Hepatomegaly simply means liver swelling. That didn't make any sense to me. What is hepatomegaly? What is the underlying cause? And so I told the doctor I would like to seek a second opinion at another radio diagnosis center. And I went there and I met a radiologist who took time to screen my mother. I was there in the scan room. I became disheartened and bitter when I saw big masses in my mother's liver. Where did these masses come from? These were not masses that grew overnight, and these doctors never saw them.
Famous late human rights lawyer Gani Fawehinmi suffered a similar experience. His son tells us how his father's symptoms were treated without improvement until he sought a second opinion overseas and discovered he actually had lung cancer.
There are so many quack doctors which people do not know about. Some of them don't even bother running tests. They just make some assumptions, prescribe drugs. But the painful thing is, those who have gigantic hospitals like Reddington, where my late father was diagnosed, he did a series of tests, and while he was still feeling a bit uncomfortable with himself, so he now decided that he wants to go abroad to go and get another second opinion. It was when he traveled abroad that I realized that he had cancer. If someone like Gani can die off like that, who else is this? A man who worked, he had his money, he could afford to go abroad to treat himself. How about those who cannot leave the shores of this country?
Mohammed says the leadership of the health sector over the years is responsible for the poor healthcare delivery in the country.
I blame the ministers. I blame this current minister, Dr. Adewale, and I blame the old one, the one who's Obasanjo's godfather, Professor Babatunde Oshotimehin, who I had a lot of grievance for. I don't know why a man like that should be made a minister. And I start to think of myself, are the older generation, people like Obasanjo, trying to kill the younger generation, or do they believe they will live forever? So this misdiagnosis, nobody is checking them, so they can afford to do as they like.
This consultant medical doctor with a federal teaching hospital advises the public to visit government-owned teaching hospitals for specialist attention when their condition shows no sign of improvement.
I always advocate government hospitals are still the best, regardless of, because in terms of specialists, that's where you get the widest set of specialists at an affordable rate. But people are always like, oh, the time, waiting and all that. It's a government hospital.
In fairness to these medical doctors, they admit that sometimes they are handicapped to help their patients because of lack of appropriate equipment for proper diagnosis and high costs of treatments.
When it comes to technology, do we have everything? Yes, we have most things in Nigeria. I'm proud to say that. But is it affordable to everyone? No. A CT scan alone is almost 40,000, and some people don't even earn that much in a month. So, and then even if the doctor writes it, knowing, okay, this is the right thing, this is what I want you to do, you can't afford it, so you're stuck.
Now I understand what the common persons face, what common people face, especially the patients. When sometimes you as a doctor know what to do, but you're handicapped by the facility to manage to know what to do. You keep querying and querying, you never establish anything. It's so sad.
A cross-section of Nigerians we spoke to on the subject had diverse opinions. Some say hospitals are too expensive anyway and would rather stick to traditional medicine.
I don't believe in the hospital, I believe in herb. Because I know that herb can cure perfectly. That's why I believe in herb than hospital.
I have my doctor, so I wouldn't be in a situation whereby going to another doctor and the doctor will give me another or wrong prescribe on a drug.
Wrong diagnosis happen because of doctors' failure to analyze patients' problems correctly. While we are encouraged to present cases early, critics hope the medical staff can be held legally accountable for negligence when that is the case. Vivienne, Irikefe, TVC News.